Despite the gradual resumption of doctors to their workstations in public hospitals, health services are yet to normalize in most facilities, with clinical officers and medical laboratory officers still on strike. Patients seeking services at Level 2 and Level 1 facilities are still stranded. Unions of the two cadres of health workers are now warning of continued industrial action until the Ministry of Health and the Council of Governors pay attention to their grievances. Emily Chebet has more.
The crisis in the health sector seems to be far from over. Other cadres of health officials were equally crucial in provision of health services. The Kenya medical laboratory officers and the clinical officers are still on strike. The medical laboratory officers, who have been on strike for more than 30 days now, accusing the government of failing to formulate a recognition agreement despite having met all the requirements. The lab officers are also demanding that all employees under their union be placed on permanent and pensionable terms of service. In their strike notice, the lab technologists are also demanding for employment of 1,000 additional lab officers to bridge the shortage in the department.
Recently, there was a report that HIV tests results that we are getting in the country are not accurate. It's because Ministry of Health has decided to engage Class 8 dropouts to test HIV. These are the people who are manning VCT centers.
Monday, we are going to withdraw all our services from the National Blood Transfusion, from the National Public Health Lab. The members that are working in KEMRI, the Research Institute, National Public Health Lab, we are going to withdraw our services. Because if we can have a strike for 1 month and the employer is not ready to sit on the table.
The medical lab officers have accused the county governments of hiring their members for as low as 15,000 Kenya shillings, adding that the efforts to address the ministry have not borne any fruit. Key issues for the clinical officers includes medical insurance cover for their members, implementation of risk allowance, promotion and redesignation of all deserving clinical officers, and payment of clinical interns as per the approved internship staff establishment by the PSC. They are also calling for the hiring of additional 20,000 unemployed and qualified clinical officers.
We are on strike to ensure that we can have equal treatment for workers. For the UHC staff who are being mistreated, and you know very well that the county continue to hold that they must continue within the next 2 years on punitive terms, which we are not supporting and we are against it.
The clinical officers have been on strike for 39 days, with the medical laboratory officers doing their 30th day on strike Thursday. Emily Chebet, Citizen.